Okay, well, we're starting anyway. I gotta go. Bye.
Hi, good afternoon. And welcome. I know some familiar faces from yesterday. The situation around COVID-19 continues to evolve. And today, I am confirming that the first positive case of COVID-19 in Prince Edward Island has been confirmed. I received a call from the lab shortly after lunch today, and the patient is a woman in her 50s from the Queens County area who returned from travel on a cruise ship. She actually did exactly what we would have wanted her to do. She came home from travel, and when she developed symptoms, she went home and she called 811. And then she was tested at one of our clinics this week, and the results came back this afternoon. We've initiated the process of what we call contact tracing, so anyone who was in close contact with her since she developed symptoms is in the process of being contacted. The woman is at home with mild illness, and she's well, and her family's well. Since our testing sites have opened, we've had 68 tests completed in the last, 3 days. And I know that was a question from yesterday. I would like to clarify some of the recommendations that we made yesterday because I think we're getting some questions about them. It's recommended that islanders cancel non-essential travel outside the country. But I think it's important to mention that essential travel, which means really the movement of goods and the transportation of people across borders, which would apply to truck drivers and airline crews, is fine. But we do think that people who are such as people like truck drivers, airline, it should monitor their symptoms every day. And we have new signage at the airports and the PEI side of the Confederation Bridge to advise incoming travelers of the recommendation that if you are returning from anywhere outside of Canada, including the United States, they should self-isolate for 14 days when they return, whether they are experiencing symptoms or not. And another clarification that we were asked about was if we had traveled last week, do we self-isolate? And we've tried to make it clear by saying if you have traveled from March 8th onward, it's recommended that you self-isolate for a total of 14 days. If you had international travel prior to March the 8th, then you should continue to watch for any symptoms. We've also had several questions about those who live with people who are self-isolating. If the person self-isolating is not showing symptoms, those who live with them can continue as normal and use good hygiene, but certainly they need to be separate in the house. So they can go to work and school, but in the house, if they're living with someone who's self-isolating, there's some specific directions on trying to keep separate in the house. But as soon as a person who is self-isolating shows symptoms, then anyone who lives with them should also self-isolate and monitor for symptoms while the person gets tested and those test results come back. We've talked about islanders reconsidering attending social gatherings where 2-meter distance is not possible, especially if there are elderly or immunocompromised present. And so for organizations and community groups looking for advice on whether or not they should hold an event, please call the 1-800-958-6400 number. And then we'll try to get back and give some advice as best we can. I'm going back to the announcement of our first case here in PEI. This is not unexpected. We have been talking for a long time about not if a case comes to PEI, but when. And we're one of the later provinces to have a case confirmed. And it reminds me, it should remind Islanders the importance of self-isolation and those measures on return from travel. Almost all the cases in the country are related to travel, so there's a reason we are asking people to self-isolate when they come home. It's also similar to most of the cases in the country. Our case has mild illness and is at home doing well. So I think those things are important for our community to know, and we'll certainly have other cases, but it's hard to announce the first case, and I spoke to the woman earlier, and it certainly was hard to give her that news. And what that means for her close contacts as well going forward, and the worry for her going forward. So I think I'll leave it there and open it up for some questions.
So a woman returned. How soon after returning from her trip did she start the self-isolation process, and how much kind of exposure did she have to people potentially on the island here?
So again, we're going to find out a lot more details as the public health does the follow-up with this woman. She arrived back in Canada on March the 7th. And then she started experiencing symptoms, as far as I know at this time, on March the 10th. And that's when she isolated herself, called 811, and the testing was performed on March 11th.
And then maybe if you could just clarify something for us. When testing like this happens, the swab is taken from the patient. Is it similar to other provinces where it's sent to a local hospital, the QE, the Summerside Hospital, and then sent to the lab in Manitoba to be tested?
Yeah. So at this point in time, and I mean, these things have changed. Initially, we were doing all our sending our tests here in PI to the Georges Dumont Hospital in Moncton, and then they were sending them on for confirmation. Negative and positive, really, to the National Microbiology Lab. With the volume of expected increased tests this week, the arrangement was made for our tests to go directly to the National Microbiology Lab. So these they were not tested locally, they were sent to the NML.
Just a follow-up question to that. What's the timeline from when the test gets to the National Microbiology Lab to when you can confirm if it's negative or positive?
Well, of course, we'd like to do it as soon as possible. And we're hoping to do it within 48 hours. This test, I think the National Microbiology Lab is having a lot of volume, as all the other provinces similar to PEI this week really increased testing, not just to those returning with symptoms from certain countries, but to any returning traveler who has symptoms. So it's generating a large volume. So it definitely took a little bit longer. We're hoping that will be quicker before. But regardless, they have to stay in self-isolation during that period of time that we are awaiting test results. So, and I think across the country, they're looking at, are there different laboratory tests that would be easier, quicker, and we're looking at whether or not we can actually get those that testing capability here, especially if this continues on with increased numbers.
So she arrived on March 7th, experienced symptoms March 10th. Have you been in contact with anyone who she may have been in contact with those 3 days that she would have been not self-isolating?
So we just got the call around just before 1 o'clock today, so that contact tracing is being initiated this afternoon. So I did not want to delay this media briefing until everyone had that process was finished, but that is underway. So certainly we'll know more likely by tomorrow.
I'm curious, as we go forward, are we going to hear about probable cases here on the island? Are we going to be updated with that, or are we only going to hear about confirmed cases?
Well, I think the probable cases are the ones that are done in like at the Moncton Hospital. They test positive and they're waiting for the confirmation. But ours goes straight to the National Microbiology Lab. So ours are, we don't have a in between at this point in time. So ours are confirmed, or they're tested and in self-isolation at home, waiting that test result.
Is it true that people should avoid to take ibuprofen to reduce their symptoms? The Ministry of Health in France just released a press. Advice about that we should avoid Advil and things like that.
I mean, I think that's not our Canadian Public Health Agency advice at this time. Certainly COVID-19, it's symptomatic treatment. There's no specific cure for it, and certainly if you're having a fever, antipyretics, Tylenol, or acetaminophen and ibuprofen at this point in time are still being indicated. But that's the kind of thing when if a country is learning from from a larger number of cases, then there's a sort of technical advisory committee nationally that they'll probably be looking at that as early as tomorrow and seeing what does that mean, and does that mean we need to change our guidance in this country. But at this point, I have not heard our Canadian guidance changing.
I'm just curious, now that it has arrived on PEI, does this change anything in terms of protocols, self-isolation, social gatherings in public schools coming back from March break?
So it's a good question. I mean, I think what it does is make me happy that we're doing all the things and we've made the given the direction we have, and I don't know. I mean, we're following suit with the rest of the provinces and the federal government as well in terms of direction around managing and preparing for COVID-19. And so I think a lot of what we're doing, we continue to do. And it just reminds us, let's be vigilant. And the importance of doing, why we're giving this kind of advice, and in terms of the school closures, that's going to be a decision that I think will likely be made later this week.
Okay. Could you just repeat that in French for our Radio Canada colleagues, please?
Okay.
Yeah.
Okay. Tu veux demander en français? Tu veux répéter la question en français? Qu'est-ce que j'ai dit? J'imagine que la décision à propos des écoles serait faite cette semaine, dans quelques jours. Et mais les choses qu'on fait maintenant à propos d'être chez vous, attendre si vous avez des symptômes, si vous retournez hors du Canada, de continuer à faire ça. Et si vous avez des symptômes, appelez 811 et on va te tester. C'est très important d'être vigilant, de continuer de faire, de suivre les recommandations qu'on fait ici et partout au Canada. C'est vraiment, on suit les mêmes sortes de choses parce que c'est pour protéger les gens de l'île Prince-Édouard et les Canadiens. Et c'est pour cette raison. I'm going to say a little bit of that again in English. I mean, the reason we need to be vigilant is that we want to protect Islanders and Canadians. So it's really important that we follow some of these recommendations and continue to do so. And because appreciating that a lot of what we see going on in PI and around the country has significant impacts well outside of health. And we're very conscious of that, and the impacts on our work, our school, our society. But I think everyone wants to certainly keep, in this case, our Islanders as healthy and safe as possible, particularly those who are most susceptible to more serious illness, and that's those who are older and with underlying immune conditions.
So with the opening of the testing facilities in Summerside and Charlottetown, is there plans to open another facility or facilities in eastern or western rural areas?
So yes, I mean, I think the testing sites are certainly very much open to change. I think these first, they've been really only up and running the first few days, and so I think it'll depend on the numbers and the volume, and we need to look at those processes, how many people are coming to those sites, and trying to figure out, are there different ways of getting people tested in other parts of the island, trying to make sure that if people need testing and they have, for instance, mobility issues, can we figure something different out? So those are, and there's different models right across the country. This is, I think, a good place to start, and we'll be watching closely those numbers over the next few weeks.
Just to follow up on that, when you mentioned folks that may have mobility issues, has there been talk about mobile testing with Island EMS or nurses from hospitals in rural communities?
So certainly, so in some places they're using community paramedics, and so that's certainly something that we have discussed. Having in some places, or in some parts of the world, they're doing almost drive-by clinics. So there's a variety of those. I think it really depends on resources. It depends on, in terms of the people who can do the testing, and also the numbers as we go forward. Now, at this point in time, when we're advising no out-of-country travel for Islanders, that's non-essential, and then self-isolating for those who do return from travel outside the country. We hopefully over time will minimize how many cases we're getting. I mean, that is the goal here with these kind of public health measures, is to flatten the curve, not have as many cases as fast, and not have as many cases.
Is PEI still considered kind of a low-risk area for this, or has this changed things?
I don't think it's changed in terms of general community spread, and I think when people talk about low and moderate and high risk, I mean, I think we have in Canada still relatively low risk of general community transmission at this time. And I mean, we all know every day seems to change in this evolving situation, but certainly, because the cases have been all linked, or most of them have been linked to out-of-country travel, then it's that's really the risk, and that's why some of these measures have been put in place.
And then just quickly, could you kind of go through the details about the woman who's come back and is the first case, but in French again for our Radio Canada colleagues?
Ok, je vais quand même essayer. Ok, so la femme est dans son 55 50s. Et puis, elle retourne dehors du pays le 7 mars. Et puis, elle était, quand elle a eu des symptômes, elle a appelé 811. Et après ça, elle a eu un test pour COVID-19. Et puis, on a eu un appel aujourd'hui pour confirmer qu'elle était positive pour COVID-19. Okay, merci.
So it's been a little while since we've had the first COVID-19 case in Canada. Do we have an idea of what the timeline is for recovery from the virus?
Yeah, so with mild illness, it typically is 14 days, so within 2 weeks. And before this person would return to work, she would require 2 negative tests 24 hours apart. And that will be consistent.
And just to clarify, how would she go about getting that test done? Will there be someone coming to her?
So some of those things will be worked out in the next few days, but we do have a guideline, and so that will maybe an option. Just to note that while she's in self-isolation as a positive case, there'll be someone in contact with her, actively following up with her every day.
And just a follow-up, you mentioned there's been 68 tests at the 2 testing sites so far. Is that what you expected to see? Are you feeling the sites are overwhelmed or underwhelmed?
I think they're managing the tests to date, and it'll be interesting to see what happens, especially as people return. Those who may have left for March break when they return. I think I'm quite pleased with that extra number of cases that we've had a chance to test in the last 3 days. Prior to that, in the 6 weeks prior to that, there had been fewer than 10 people tested. So I think we certainly, and that was as per direction at the time, testing people from affected countries. So I think doing more testing is good, and it will increase the numbers across the country, but still the focus on containment, because if we identify a case, the importance of doing good contact tracing and self-isolation will be really important to limit that spread in our community.
Okay. And just one final question for myself. In case someone does have symptoms and they go to a hospital just because out of fear or just wanting to get medical help, is there any sort of isolation protocols at hospitals on PEI for folks who may be showing symptoms?
Yeah, so if they present with cough, fever, they have a mask put on them, and then they're asked about the travel history, they're usually put in a room that has negative pressure if they're at a hospital. It's part of infection prevention and control. We have to remember this virus is spread by respiratory droplets, so similar respiratory precautions should be in place for influenza as well. Okay, so
Of those tests that we've done here and sent to the lab, how many of them have come back, and how many can we expect to come back in the coming days?
Well, I think we expect results to come, so many to come back every day. I'm called for every positive case, and will continue to be until in case the numbers get too many. But so we expect those calls on a daily basis. It doesn't matter if it's Saturday or Sunday.
And did all 68 of those cases and all those tests rather go to the national lab?
Yes,
Yeah.
or are in the process of being flown out there.
When, between the 7th and the 10th, how much do we know kind of about the activity of this woman? Was she kind of carrying on as normal, or did she go to work, or?
I think that's part of the follow-up with public health nursing, so I will have more details tomorrow on that. As I said, they literally are just doing some of that follow-up and further information gathering as we speak.
You mentioned yesterday that there had been 23 lines added to the 811. How has that been helping or not helping, as it might be with congestion?
So I'm supposed to go on a call at 3 o'clock, and I'll probably get an update. There's an expected update at that time, so I'm sure it's probably close to that now. Again, something we can discuss tomorrow too, and report back on. Okay. Anyway, thank you very much. We'll continue to have these on a daily basis, my understanding. So anyway, thank you for your questions.